So we're back from Thanksgiving break. I hope you had a wonderful break with family and friends. And we're on to our last full learning unit, which is a shortened learning unit, because the final thing that we have for this course is our final course reflection. There'll be a separate video for that. But please, number one, note the dates. Learning unit number 7 comes to an end December 6th, and then the final course reflection is due December 12th. And that is the last day that these can be accepted because of the grades needing to be in, and December 12th is the last day of finals week. So let's look at learning unit number 7, advocacy for the vulnerable. You're watching this video. We know we have been looking at the vulnerable populations throughout this course, and now we're looking at the concept of advocacy, both for our vulnerable populations as well as for the nurses that we lead and our individual patients, groups, and populations. And one of the best ways to define advocacy is an activity on someone else's behalf directed toward a specific goal. So you might want to read that again. An activity on someone else's behalf directed toward a specific goal. For the nurse leader, our goal is a better state of health. During this course, we focused on a better state of health for those who are most vulnerable, including the vulnerable populations that we've signed up for, as well as the nurses that we lead. So according to our authors of Compassionomics, Trzeciak and Mazzarelli, compassion protects the vulnerable. It's about treating others the way they ought to be treated, the way that they want to be treated, and the way we would want to be treated ourselves. So we're looking at the end of, by reflecting on the American Nursing Association's Code of Ethics, specifically Provision 8, and also articulating the evidence that making human connections, serving and caring for others, has proven stress relieving benefits. So you will have a discussion board post. No reply is required. And let's move along. For the first video is on nurses having the power to influence health equity. And note the social determinants of the health account for up to 80% of a person's health outcomes. So you're going to watch that 6-minute video. And the next thing, I think it's a treat, but Trzeciak and Mazzarelli, our authors of Compassionomics, had another book that came out in 2022. It's The Wonder Drug. And it's more for the lay person, and it has some similar content, but it is another stellar book that you may want to also get for reading over Christmas. Sounds like a good Christmas gift. But in the meantime, there is an audio interview on People's Pharmacy. I don't know if anyone else listens to that, but that's a really good podcast to listen to, and the interview starts at 6 minutes and 15 seconds. So if you of the audio, so click on here, and you can hear Dr. Trzeciak is the one being interviewed, but about the book Wonder Drug: Serving Others is the Best Medicine. And then our final reading is regarding the American Nursing Association's Code of Ethics, Provision number 8, in which the nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. So it's a short 1.5 page article about ethics and social justice. And the discussion board for this learning unit I wanted you to reflect on a couple of the quotes that came either from the audio interview or the book, and I want you to reflect on these three quotes. And then for this discussion board, please answer the following. How can the evidence shared by our authors of Compassionomics and the authors of The Wonder Drug, according to People's Pharmacy audio interview and our readings in Compassionomics, so how can the evidence these authors have shared guide us in advocating for ourselves and the nurses that we lead? Let's take it a little bit different focus from our vulnerable populations to actually advocating for ourselves and the nurses that we lead. So that's it for learning unit number 7. But please note again the shortened week, and I'll come back at the same time that this learning unit number 7 opens. I will open up the final course reflection as well.